Navigating through medical bills is already tough enough. Pair that with losing a loved one to COVID-19, and it can get downright overwhelming. New at 10, one Valley man reaching out to ABC 15 saying he's dealing with $2 million in healthcare bills. $2 million.
Yeah, but thanks in part to ABC 15, he most likely won't have to pay that much. Investigator Liliana Soto shares his story so others can learn from his experience.
I'm sorry.
Ricardo Aguirre's life has been torn apart by COVID-19.
So a lot has happened over the year.
He lost 10 extended family members to the virus. His business took a major hit.
We lost many contracts that we had. We had another food truck, a kitchen that we rented. We lost all of that.
Then he and his wife got sick with COVID. Eventually, his parents were hospitalized with the virus.
Unfortunately, my dad passed away. I miss him so much.
Ricardo didn't even have a chance to grieve before the bills for his parents came in.
$4,000, $5,000, $10,000.
Bills from 3 different hospitals.
Can you please tell me how much this is for?
This is $1,438,446.66.
His dad had Medicare, but was responsible for 20% of his medical debt. His bills were sent to Ricardo's mom, and then her bills came in too.
The latest one that we received was for $56,000.
Legally, Ricardo doesn't have to worry about his parents' bills, but morally.
She's here, she's alive.
So he tried his best to work with the finance departments at hospitals without success.
La verdad no sé cómo hacer que esto se vaya. I just don't know how.
He took his parents' financial burden as his own, but he felt alone. What he didn't know is that there's a group of over 150,000 people on Facebook
Dealing with the after effects of the virus, just like him. While searching for help, we found Jamie Masengani, a Glendale resident and healthcare consultant.
If you're not insured or if someone has passed away, a lot of hospitals will write off that balance with the proof of death certificate. But there's always, for low-income families or low-income people, there's always state assistance. And then again, at the local level, the facilities have sometimes called charity plans.
Through this Facebook group, she's been helping patients navigate medical billing and negotiating on their behalf with hospitals for free.
The half a dozen people I think I ended up helping eliminate their entire bill was just because it hadn't been coded right.
People like Ricardo could also benefit from federal funding. According to the U.S. Department of Health and Human Services, his parents should have to pay very little or nothing at all. Money from the CARES Act should cover them because his dad was on Medicare and his mother was uninsured.
That's when the hospital should be billing to the relief fund through the government. We call them HRSA accounts. If the hospital has taken any sort of grant or payment from this relief fund in general, they cannot bill uninsured patients.
Jamie is now in contact with Ricardo. State Representative Raquel Terán has also reached out to him after ABC 15 contacted her office.
Push and push and push. Don't accept one person telling you what you owe.
Ricardo says his mother is relieved. He thanks ABC 15, but he knows there was someone else looking out for him.
I know he's got my back. He always did. And I know that everywhere I go, he's with me.
Liliana Soto, ABC 15, Arizona.